Hello, good morning. Today I am going to show you the Peroneus longus graft harvesting in the cases of revision ACL reconstruction. This gentleman is 22 years old and 2 years before he had surgery for the ACL. But again he got injury and his ACL is torn out. So we have in the generally revision ACL cases, we are a little bit worried about the graft harvesting, from where we are going to take the graft. So in that situation, Peroneus longus graft is very biomechanically very strong and thin and long graft. So now I will take you the steps of the graft further and come back to it.
In this patient is supine, I will keep on blister under the hip to make the foot internally rotated, and will make an incision around 1.5 to 2 centimeter proximal to the distal end of fibula and on the posterior aspect, and now we'll carefully dissect the skin and around 1.5 to 2 centimeter incision, and then we'll expose the subcutaneous tissue and the fascia over the tendons. So now I'm just going to dissect the skin, and now this I'm retracting the fascia. We'll put the scissor under the skin so that the fascia surrounding the muscles belly will be separated, and it will be easy for harvester to take the graft. And in this technique, this is the most important part is the identification of the tendon. When we are able to identify this peroneus longus tendons will be little deep and posterior, whereas brevis tendon will be anterior, and peroneus brevis tendon is like having a muscle belly, which I am going to show you shortly after the dissection. The incision was little less, so I'm just increasing the incision, and you can clearly see that this is like 1.5 to 2 centimeter incision only. So it will be a little bit we have to retract with the this ligament back. Okay, proper dissection is very important to separate the tendon. And now we will take the hook and we'll try to take the tendons. You can see clearly the glistening structure. It is a tendon, and it's just posterior aspect, so it's you can see that it's a clear glistening structure, and there is no muscle belly in this, so it's the peroneus longus tendon. And we'll put the artery to keep the tendon outside. And now I'm going to take the second tendon, because before harvesting we have to always make sure that whether this is peroneus longus or peroneus brevis. And now I'm going to harvest the another tendon. And this should be a little bit posterior. There is, like you can see, a little bit lateral to the posterior malleolus. Lateral malleolus, posterior aspect of the lateral malleolus. See the both tendons, we have to hook it, and now you can check the muscle belly. Okay, and you can see that there will be a little bit muscle fiber you are able to see, but it's look little bit is very small, so I think it's become very difficult for you guys to see this. So now the most important thing is we have to do the tenodesis. So how we are going to do this? We are just make the peroneus brevis tendon. We have to identify first, and then we'll suture with the peroneus longus tendon. Okay, at the distal end, I am using this vicryl 20. So this we can just tie the both tendon together, and we'll just put 2 stitches, 2 to 3 stitches usually is more than enough to hold the tendon in the proper place. And So I'm going to take this second day stitch now. See this. And now after the stitching this one, I'll cut the suture and just untying the suture now. Cut the suture, and then we will take 2 to 3 bites in the Peroneus longus tendon, and after that we'll cut the distal end of the Peroneus longus. And the most important thing is that when before dissecting the tendon, just try to separate the muscles. See, so that this is the Peroneus longus tendon, which I'm going to put the 2 to 3 bites, so that it will going to help in the harvesting of the tendon. And this tendon is very thick. You can see this is generally for the ACL reconstructions we need like 8 to 9 mm. Okay, like if you are doing all inside, then it will be around 5 to 8. But this is one tendon is like more than enough. Like it's in the length also, it's like in the good length, and its thickness is also right. This is around you can say like 9 mm. You can say easily, yeah. So after putting the suture, I will cut the distal end of the Peroneus longus tendon, because we have to gain the maximum length. So now I will use this 11 number knife to cut the distal end, and see, and I'm just pulling the tendon. Before putting the harvester, one must be careful to put the artery or anesthesia to at least in the proximal, because there is sometimes some adhesions is there in the just proximal part of the tendon. So we'll put the arteries or anesthesia to separate the surrounding structures and fascia from the tendon, and this will going to help me for the easy harvesting. So now I'm going to put this closed harvester. I like, preferably if you'll ask me, I like the closed harvester, because in this open harvester I observed the chances of graft failure is more common. So I'll prefer to go for the closed harvester for the smoothing, and I'll push the graft inside and pulling the tendon outside. And one most important thing is that you have to put your one hand like over the neck of the fibula in the upper part, and like 4 to 5 centimeter down the fibula. You have to restrict your harvester till there, and you'll put the harvester inside and try to pull the Peroneus longus graft outside. So once there will be muscle belly, and if you pull, it will come out. So you can see the very long graft and looks like in the good thickness. Now I have closed the skin like it's 2 sutures.
Thank you for watching this video. For more surgical videos and update, please do subscribe and like. Thank you.